Hospice is a comprehensive management of patients with limited life expectancy. Traditionally, we expect the patient would not live more than 6 months, and we would provide comprehensive medical, psychosocial, and spiritual management of the patient.
Hospice is the backbone of the work that we've done for 47 plus years, and I always think of it as a haven for families who are struggling with an impending death of a loved one, somebody they cherish and can't imagine having to say goodbye to. And our wonderful, dedicated team that includes doctors, nurses, social workers, LVNs, our hospice aides, chaplains, and even dietitians wrap around our families, our patient families. And I remember thinking that, I heard about hospice years ago before our family had to use it, and I really had this idea in my mind that it was all focused on the patient. And while that's very, very true, we give an equal amount of education, support. I mean, it's the knowledge that the nurses have of the timing of things so that we carefully prepare families for the inevitable and make them the hero in their patient's life.
Hospice is about caring for patients in one of life's most tender moments. We make sure that no one walks through this journey alone. We care for our patients and their families, spiritually, emotionally, and physically, as they face their end-of-life situations.
So we have a program that's 8 years old that we've called palliative care for a long time. It was Community Care Choices when it was first born. And the intention was to support people who were not hospice eligible but had a serious illness, and we wanted to improve their life. And so we've been doing that, but it's kind of morphed because the program at this point in time has more to do with managing folks. We support them still in their homes, wherever they call home, with nursing care and social work. So we do provide a layer of support, but it does not include pain management. So we're not writing prescriptions for these folks. Their PCPs are still doing that. So we're looking at really calling out the program for what it is so it's clearer for our community.
We have a service in our Community Hospice and Health Services program called palliative service. And traditionally, palliative service refers to the aggressive management of patients' symptoms in certain subset of patients. And in our service, we rely the medical treatment, the medication treatment, back to the primary care physician. So we focus more on the non-pharmacological management. So that being said, it is very effective, and that involves visitation from our registered nurses and medical social workers. And they want to make sure that patient is compliant with them taking the medication, follow up with the primary care physicians, and also whatever changes in condition they would detect early. So in effect, that will result in less hospitalization and less visits to the emergency rooms.